Ay, nalangid. Nge. Wait. Maprops na kita. There you go. Lungkuan ni Panda. Kita. Okay. Okay yun? Alright! Sige. Huwag niya sakto. Ay. Alright, that will be fine. Just don't fall. Okay! Ay. Buti tayo mag-maintenance it ng bangs. Anyway. I cut my hair para it's like my birthday gift for myself. So, ay! Nahulog siya. Wala ilang gid. Pika nang dyan. Okay. What is the purpose of this vlog? Okay. I have to be honest that I like watching YouTube videos than reading my books. So this could be a good idea for me to get reminded about the things that I've learned in school, or maybe the highlights of what I learned today. Okay. By the way, this is a new stethoscope. After 3 years at work, I lost my stethoscope because, I don't know, somebody just stole it or something. But anyway, also from somebody, it's like a suggestion for me to have a vlog so that I could practice my English. Because, to be honest, it's not good. Okay, so disclaimer, ako, Taglish, Karaya, or Bisaya / Tagalog / English. So I can't perfect everything. But it's a process. So anyway, moving forward, today I started my clinicals for my pediatric rotation, and it's just a half day because my preceptor only works half day today, and I have 8 patients. So from 8 to 12 o'clock, 8 patients is not bad, right? So most of them are babies, or 7 days old to 1 year and a half. So things that I've learned is, like, first of all is the birth weight of the patient. So aside from the vital signs, we're kind of looking at the birth weight of the baby, especially those that are 1 week old. I have a baby earliest 1 week old, and the first thing that I have to remember is their weight during the 1 week old must be above their birth weight, because the baby's birth weight after the birthday, they will slowly gradually decrease their or lose weight, but then after 1 week they're expected to have more weight gain. I mean, yeah, somehow like that. So number 2, the anticipatory guidance for the mom. So let's say moms have idea how to take care of their kids because of the commercials, the books, or maybe during their prenatal checkup they've been guided on some things that are important, but it's important for the provider to reinforce them. So isa na example ang seatbelt, especially for those kids that are less than 2 years old, because the latest recommendation is the baby has to have a car seat rear facing in the back row. Well, one thing, in the Philippines, it doesn't work like this, because ang mga baby, pwede sila mag-sit down sa atubang. They can sit in front. However, here in the US, they cannot sit at all, or else the mom or the dad, whoever, the parents, will be in trouble. Okay. By 2 years, I mean by 2 months old, the baby, you have to promote a tummy time with the baby. Like, let's say tummy time, their stomach has to face down, or like prone position, like this. Whoosh. Well, the reason for this is because, wait lang, because for 2 months, you have to make sure that, that the baby will start to strengthen their muscles, or they have to like strengthen like their extremities. So the tendency of the baby will be like they're trying to push, which that's what happened to the baby that we forward now. Yeah, we made him prone position. So but take note, it has to be 30 minutes to 1 hour, and it has to be supervised. Dapat makita gid ang makita ang baby, because we don't want like sudden infant death syndrome or something when they're placed in a prone position and they get suffocated, or we don't want something bad happening. So supervision, and also ask the mom basically if the baby is eating or feeding well. Okay, third one, it's about the consults. So as a primary care provider, we tend to always consult those specialists. So I have a patient that had this, that I have to refer to podiatry. That's reason is because the past year they've already been treated with a food infection, and he was given with a medication or antibiotic, which is mopirocin. However, it was not healed. He didn't injure his toenail. However, again, nagka-infection in the right toe, and at this time around there's another infection in the left toe. So something's going on there, something iffy about it. So podiatry consult. The next that I've encountered is a neurology consult. Why? Because some babies, when you try to look at their butt like here, there is a dimpling. Okay, so we call it sacral dimpling. So why is that really important? So maybe if your baby had that dimpling there, your baby might have some disorders or neurologic disorders, so might have a spina bifida that will actually affect your baby's growth, or like walking or something. So actually it's really complex, so I don't want to discuss about that. And then fourth thing, so the common reasons why, or common chief complaints why the babies or the pediatric patients are coming, is that just for today I've seen rashes. Of course, there's always routine physical examinations every year. Sore throat, fever. Okay, so take note, if your baby for the first 3 months spike a fever 100.4, that's really important, because fever can mean different things. So it's like a danger sign for the first 3 months. So next, okay, another patient have a rash. So ang rash, it's kind of hard to have a differential diagnosis to a rash. The rash could be itchy. You have to ask if it's itchy or not. So I have 2 patients. One patient have a rash, and it's in extremities, and it starts with the legs and mostly in the extremities, lower extremities, upper extremities, but there's less rashes in on the stomach area or the trunk area. So that kind of rash or the distribution kind of spare the trunk area. So, and first of all, it's itching. So we kind of lean towards the diagnosis of having scabies. So we gave the Elimite solution, so to help out with that itchiness and to make the baby more comfortable, and add Benadryl for sleeping as needed. Okay. Another patient that has a rash is that I asked first if it is Itchy? Okay, it's not itchy. It must not be a scabies. Another one, if the patient has a fever. The baby had a fever. Another one, we ask if the patient has a sore throat. Okay, so where's the rashes? Ang rashes niya is in the legs, is in the arm, it's not itching, the patient has a fever, and there's a sore throat. So from that, a patient has a hand, foot, and mouth disease. So that's a good thing. So I kind of have an idea of differentiating two kinds of rashes. So of course there are other diagnoses when the patient has a rash. It depends on where the rashes are, if it's itchy, if you know other symptoms like fever, because sometimes the kid may have some rashes here, like here we call it like fifth disease. It's like a slap in the face, but some ganina. So that's it. That one is a hand, foot, and mouth disease, and basically the treatment is symptomatic, or no, not symptomatic. Since it is a viral infection, we kind of treat the baby with Tylenol and Motrin every 4 hours, alternate. Yeah. What else? Physical exam. All right. Number 5. So part of the physical exam is making sure that the baby has an up-to-date examination, or no, up-to-date vaccinations. So I have this baby that is 4 months old. So at 4 months old, you're supposed to have the second dose of diphtheria, pertussis, tetanus, influenza, polio vaccine, rotavirus, and also pneumococcal vaccine. So yeah, so dapat this baby is supposed to have it as a second dose in 4 months. However, the baby came late. The baby is already 6 months old. But anyway, it's hard. I will put a link below about the catch-up vaccination, a link wherein I can use to formulate the baby's catch-up vaccination, or also the CDC link for CDC, Center of Disease Prevention Control, Center of Disease Control Prevention. What? Never. I'll just put a link below, and actually that website has a vaccination schedule from birth up to 65 years old and above. So bottom line is just it. Physical exam, you must be sure about the vaccinations as well, because right now, before bringing your child in the daycare or exposing the child and other kids, or sending the child in school, is really a big requirement to have all the vaccinations done for the first and a half year of life. So that's really it. Well, I guess that's it. I guess that's all for my day. Ay, panda. Ay, bye-bye. But I'm sorry, by the way. I'm not Ingbisera, but it's fine. I'm trying. That's all that matters.